All right. I am going to go ahead and kick us off. So good afternoon, and thank you for joining us for our fifth Speaking of Change webinar, where we bring together expert panelists to take a deep dive into particular aspects of the child welfare system. Our goal is to break down common assumptions and misconceptions about foster care, to elevate the voices and stories of people most impacted, and to share ideas that can bring about needed changes to the system. My name is Ruth Tollefson. I serve as Amara's Chief Philanthropy Officer, and I use she, her pronouns. Whether you're meeting us for the first time today or you've been on this journey with Amara for a while, welcome. At our core, Amara's work is to improve the well-being of kids and families who have been impacted by the child welfare system. Today's conversation is such an important opportunity to talk about why, if we truly seek to make meaningful and lasting change to foster care systems, we need to ensure that our programs are designed with, led by, and rooted in lived experience. Before I turn the mic over to our next facilitator. I'm also running my slides. So here is just a quick slide with Amara, Amara's information. Before I turn the mic over to our amazing facilitator and panelists, I would love if everyone could share into the chat your name, what brings you here today, and again, what native land you're joining us from. I'm just honored to be coming to you today from the traditional land of the first people of Seattle, the Duwamish people past and present, and honor with gratitude the land itself and the Duwamish tribe. So if everyone could just take a moment to put into the chat, because I believe we have some people from all over the country today. All right, thank you. All right, so our next item is just a little bit of details, just so you know what to expect for our time together today. So my last note before we get started is that throughout the webinar today, everyone will remain muted. And so if you have a question or a thought, please, questions especially, use the Q&A box. We're monitoring those and hope that we'll have some time at the end to get to those questions. You're also feel free to use the chat if you have comments throughout, but specifically a question, go ahead and use that Q&A. We're recording this program and we'll email it out to you afterwards, along with answers to any questions that we may not have time for today, or if it's a really complex things, but hopefully we can get to everything today. All right, so now I'm going to be introducing today's facilitator, and that is my colleague, Trey Rubin. And then he'll introduce our amazing panel. So Trey is Amara's Associate Director for Kinship Programs and has been with us for almost 12 years. He's a former foster parent, an adoptive parent, and he's been part of the team at Amara that's really helped transform our approach to supporting kids and families in foster care. And that's included all the work he's done to lead our move into providing kinship caregiver supports. All right, Trey, I will let you take it from here.
Awesome. Thank you so much, Ruth. And thank you to our amazing panelists and to all of you attending today's.
Oh, Trey, we can't hear you.
Seriously? Uh-oh.
Oh, you can? Okay, never mind. I'm going to just mute myself and go off camera.
I was like, oh no. But yeah, thank you panelists for being here. And thank you to all the amazing folks from around the country, which is really exciting to come to learn and share with us today about the power of community-centered program design. We are going to have our panelists kind of briefly introduce themselves before we start the conversation, so you all know who they are. And then we're also going to drop a link in the chat that has a link to longer bios from everyone so you can get to know us even more. But yeah, I might as well go on order here in this little chart here. So Teresa, if you'd like to go first.
Hi, my name is Chelsea DeFair. I am a parent ally, parent with lived experience here in Washington State, and I, she, her pronouns, and Spokane, I reside on the Spokane tribal lands.
Awesome, thank you. Patricia, you there, Miss Pat?
Yes, I am. Hello, everyone. My name is Patricia Hayes. I'm a licensed kinship caregiver. My husband and I are the caregivers of three wonderful granddaughters, 16, 7, and 4. And I live in Washington State.
Awesome. Thank you, Deshauna.
Hello, everyone. I'm Deshauna. I am a kinship caregiver of 7-year-old twins, and I live here in Washington also.
Thank you. Deborah.
Hi, everyone. I'm Deborah Collins, she, her pronouns, and I'm the Associate Director of Programs for our Parent Support Services at Amara, and I am hailing here from the Duwamish lands. Thanks.
Thank you. Dr. Day.
Hello, good afternoon, everyone. It's officially afternoon, regardless of where you are tuning in today, I think. My name is Angelique Day. I'm an associate professor in the School of Social Work at the University of Washington. I am also a former foster from the state of Michigan. So I grew up in the lands of the three fires people, the Ottawa, the Chippewa, and the Potawatomi, but am coming to you today from the University of Washington, which is on Duwamish territory. So thank you for having me.
Thank you. And last but definitely not least, Ambrosia.
Hi, welcome everybody. I'm Ambrosia Eberhardt. I am a parent with lived child welfare experience. I use she, her pronouns, and I want to just say happy Trans Visibility Day. I wished my daughter that today, so that was exciting. In tribal land in Spokane, Washington.
Awesome. Awesome. Thank you all. And I realized I didn't do my pronouns, so I he, him pronouns for myself. And I just moved, and I probably should know my native lands. I'm pretty sure it's the Muckleshoot down here in the Kent area of Washington State. Pretty sure it's Muckleshoot. So wanted to share that as well. All right. So we're going to jump into the program, and I'm going to give a brief kind of definition of what we're talking about, and I'm going to pass it over to Dr. Day to give kind of a brief overview of kind of what the research says about what we're talking about today. So community-centered, also called participant-centered design, really is about when you're creating programs, implementing programs, doing program evaluation, really making sure that you have folks who are going to be most impacted by those programs or have in the past involved in that entire process, from submitting that grant application to the program design to those first couple of days where you implement the program and some of the things you thought would go so smoothly aren't going so smoothly. You have to pivot on the fly to the evaluation and kind of the end part. We really value the lived experience. I think historically the field has not done that, and we would bring together practitioners, researchers, professionals in the field and create programs that we thought would be the best for the communities that we were serving. But oftentimes we saw a lot of the mishaps and a lot of missed things along the way in doing that. And so really the field is really moving to using those who, like I said, will be most impacted to make sure that they're influencing and impacting how the program is designed and ran. So with that, I will pass it over to Dr. Day to talk a little bit more about what the research says about this.
Thank you very much. And I think it's always good for us to start out with formal definitions so that we and all the listeners here are on the same page in terms of what do we mean by community-centered program design. So I'll start off with a definition from the literature. And so this concept is really a collaborative problem-solving process that lets community members, including those from our target population, have meaningful interaction and decision-making power in intervention design, specifically around services that they will be affected by. So there are some fundamental characteristics of community-centered design that I think are really important for us all to understand and agree on, and that is professional and lived experience folks. And in the context of our program, we're specifically defining lived experience as kinship caregivers, birth parents, and former system-involved young adults who are all collectively working together in a relationship-based way, in a relationship around equality and respect. And I think these are really important characteristics that are critical when you're working on a community-centered design project. So, and that these characteristics are really important because they're ensuring that both the services we provide and the systems in which those services are provided, which includes policies and procedures that outline program implementation, that they're fair and responsive to the needs of our target population, and ensures that the agencies that are in charge with implementation are being held responsible for carrying out that work in a good way. So in the context of this project, we're defining our agencies as both Amara as the service provider and the University of Washington as the evaluator, because we both have to be responsive to our lived experience experts in how we're doing our work, and that we both as agencies need to be accountable to our families that we're working with in the implementation and evaluation process. I'd also just like to add that community-centered design program models is really a strength-based approach. I think that is another critical element for us all to agree on. That again includes intervention planning, and the development of evaluations and evaluation measures. And I'm excited to talk with you about and give you, as we have this conversation, some concrete examples of how we've done that in this project that Amara is overseeing on all of the partners' behalf. So thank you, Trey.
Awesome. Thank you. So yeah, now we will jump into the discussion questions, and I'm going to make a executive decision and skip and move around questions. So, but I feel like based on what Dr. Day said, I think it makes sense to go and to talk about our programs. I think so folks know kind of the context of what we're talking about. So, like Dr. Day said, we are currently working on a federal grant, and it's called KEN Plus. It stands for KEN Placement, Licensing, and Unconditional Support, and it's a partnership with Amara, DCYF, and then University of Washington. And really it's an intensive, about 9-10 month program for kinship caregivers in King County. It's a pilot who are interested in getting licensed. We kind of provide supports up front around completing all the different licensing requirements, and then provide kind of wraparound placement support simultaneously. And then once licensed, continue to support the placement and the caregivers to make sure they've got everything they need to be the awesome caregivers to the youth in the home. And when we created this program, we created an advisory council to help inform how we were going to create this. So we spent our whole first year plus in this program design phase, and we met monthly as a council. And we just had various questions, and they really reviewed every aspect of our program. Anything that a client is gonna be administered, like a survey or a tool or other things, they reviewed to make sure that it looked good and that we didn't miss anything. Our council is made up of about half professionals and then half folks with that lived experience, so kinship caregivers, former youth in foster care, and parents as well. And I think what's really cool about our group is that even a lot of the professionals, there's overlap, right? So like folks wear the professional hat, but they're also a kinship caregiver, or, you know, they, are professional, but they also do this. Something that's really cool that we have a lot of like folks holding multiple hats in our group. And I think it really adds to the great discussions and stuff that we have had in that work. But given that two of the panelists, Deshauna and Patricia, are on that council, and I just wanted to pass it along to you and just talk about your experiences kind of helping Amara build out this KEN Plus program. So yeah, go ahead. You got it, Ms. Pat.
Hello, everyone. I'm Patricia Haynes. And as a member of the KEN Plus Advisory Council, my experience was very positive. I felt listened to, I was fully engaged, and I enjoyed the collaborative efforts of all the team members. And as Trey said earlier, I mean, we spent a year plus looking at the program, reviewing reports, reading survey information, and all of us working together at the end, I'm sure felt a sense of accomplishment, because we believe we now have a program that's going to make a huge difference for a lot of families in our community. My experience was absolutely positive. Thank you, Trey.
Yeah, thank you.
Yeah, I would just second that. My experience has been great. It's been really great to be in the room and just collaborate. And, and be able to look at it from the point of, yes, being a caregiver and saying, like, these questions could seem overwhelming, and just being able to, come together and kind of like troubleshoot how we can, make these questions feel accessible, feel like something that the caregiver can do and complete and take on. And so, yes, it has just really been a great experience. It's also been great, the diversity that we have in the room, because, we have people coming from all different walks of life, and they just are able to touch on that and bring that in, share the nuances that they've noticed and the experiences they've had. And so it's just been, a really great collaborative space. And I've been really appreciative of what we've been able to accomplish.
Awesome. Thank you. And later on, we'll kind of get into some examples of kind of things that we did, things that came out of this group that never would have been created if I created this program solely as a professional. And so we'll get into some of those examples later, but I wanted to pass it along to my colleague, Deborah, to talk about how they've utilized this community-centered design and some of the work that she is doing over in her department.
Thanks, Trey. So I'm going to talk about a couple programs that we've been piloting and have started at Amara, and they're really centered around prevention, early engagement, and supporting families. So we have a partnership with DCYF with our Parent Focus program, which is a pilot out of Grays Harbor and Spokane counties, and it's and the acronym stands for Family Outreach Connections and Unconditional Support. And really focusing on like how we are able to support parents and the stability that they need. And this program is working with families who are in the really early stages of DCYF involvement with family voluntary services or with family assessment response. And the goal is to really increase the child and family safety and stability of what might be going on with the different allegations and investigations that they have been going through. With the hope of reducing CPS referrals and intakes and removal of the children from that family's home. So it's a small pilot right now, and we're hoping that, as it goes on, that we can kind of expand this to other counties in our state. And the other program that we have started, and it's based out of our Tacoma office in Pierce County, but it's a family resource center. And but it's also accessible to a lot of families who don't necessarily reside in Pierce County. But we provide a lot of different concrete goods to families who might be in need with our food pantry, our diaper bank. We have car seats and different items that we might be able to provide through donations with clothing and toys for kids. We also have a concrete goods program that specifically helps with people who might need assistance in getting different things that they might not be able to, or help them navigate resources in their community. So with these programs, we really look to working with and collaborating with people who have lived experience, and we held listening sessions with Spanish-speaking families in our Pierce County area, to parents who have lived experience and parent allies in Spokane and Grays Harbor counties, and had many listening sessions with a lot of people, and then formed an advisory group for our parent focus program specifically, so that we would have a lot of different voices and perspectives represented in designing our program. And we have that advisory group continuing on with us so that we are evaluating how our program is doing. So I would like to invite Ambrosia and Teresa, who were involved in our listening sessions, and Teresa, who is on our advisory council.
Hi. Yes. So being able to be a part, like what I like how I can put it into perspective is that when parents with lived experience are come to the table and can be part of an advisory process or focus groups, we're not just bringing the fact that we're trauma informed, we're also healing informed. And so what we're sharing is a pathway to healing and what it takes to heal. And part of our healing process is being, it takes transformation, it takes creativity, it takes all these different strengths, which also is strength-based, that we can bring to the table to come up with, also, creating hopefully a system and programs that people, parents and children and youth, that they come into a system that they can heal through, And so they instead of needing to continue to heal from. And so it's just really that upward mobility into a healing pathway. And I just really appreciate that being embraced by Amara and all the different ways that they do that for folks with lived experience. You know, from and hearing all the different perspectives and the different ways that folks have been involved with the system. And so there's more of like a wraparound. It's not just a cookie cutter approach. It's not one size fits all. It's like, how many ways can we show up to support those who need support? Ambrosia?
Gosh, thank you, Tressa. That was amazing what you just said. So I have like a core belief that investing in lived experts in all the different ways that we can be lived experts, right? And professionally developing us just builds a world and brings valuable voices to the table. It can be a driving force for community-centered design programs. Lived experts produce compassionate, empathetic, and inclusive outcomes, programs that are created without the input of feedback from people who have gone through similar experience can sometimes like miss the nuances and subtleties that may be vital to the program's effectiveness. Additionally, including a diverse range of perspectives can identify unique solutions to problems that may have been overlooked otherwise. I love that like I get, you know, parents seek me out in Spokane, and when they do, sometimes they are on the front end of child welfare, and I'm able to then like email Deborah and say, hey, can you support these parents, right? And so knowing about Amara's programs and also knowing about Concrete Goods and that, you know, in unique times, we can tap into that and ask for a parent to be helped. So thank you.
Awesome. Thank you both. Trista, I love the healing informed. I've never heard that, and I truly, truly love that. And I have seen that in the work of the folks that lived experience on our council. So yeah, I love that twist, and I'm going to start using it. So thank you for that term. I love it. I love it. I love it. Another thing I heard too for you, Ambrosia, is talking about the importance of kind of diversity of thought is so key on these councils. And so I would love to move into the next question around how does recruitment work? How do you get folks with lived experience and diversity of thought onto this kind of council? So I don't know if Dr. Day has something to say, and then other folks can go after to kind of talk about that process.
Yeah, absolutely. So there's a few really amazing structures that exist in Washington State that I think, because Amara has close connections and partnerships, really supported the ability of Amara being very successful in recruiting an advisory board with a high percentage of lived experience folks. So I want to give a couple concrete examples, and for other state listeners on the call I'm going to challenge you to do some homework in your states to see if you can investigate what opportunities exist within your state that you can tap to help support your work in this area. So we are very blessed in Washington State to have the Parent Ally program. Teresa mentioned it just very briefly when she did introductions. And that program has really provided some strong infrastructure in Washington State to build an amazing birth parent, workforce that has knowledge and skills to lend their voice in system reform and program building efforts. And I think Parent Ally is a program that has been looked at by other states across the U.S. And if you haven't heard about it, that's your first homework assignment from your professor on this call today, is to look into that program, because it really has given birth parent voice a huge influence in the state of Washington in program development and policy. And Amara was a smart enough agency to grab onto that resource and embrace it early on in the Kin Plus development program. So shout out to Parent Allies in really creating that new structure for birth parent voice. Another important system policy that Washington has, another great shout out, because Washington is progressive in terms of their use of lived experience. And I hope Washington can be a model for other states in the country, and that we really have some of the most vocal kinship caregivers in the country. We actually have precedent using legislative statute in the development of our KCOC, Kinship Care Oversight Committee network. And that legislation mandates that 33% of our leadership body be lived experience experts, and that lived experience voice is used regularly in program development and policy change that runs through that KCOC committee, and that many of the caregivers, shout out to Pat, who's on this call today, and we have others on the advisory board who are members of KCOC. And again, Amara very smartly tapped into their connections with KCOC as part of their kinship caregiver recruitment process for their advisory board. So easy, low-hanging fruit in your states. It takes some time to explore your lived experience networks for all of these different lived experience folks. Most states have advisory councils that involve lived experience, those with foster care experience, but it is important that when we define lived experience voice, especially in this type of work, that we define it using all three of those lived experience voices. And again, here we're talking about birth parent, kinship caregiver, and young people with lived experience in foster care. So we're trying to raise the profile on what do we mean by lived experience voices, and ensuring that all three of those voices are at the table. And I just want to give a shout out to our agencies in Washington State that have our lived experience voices in foster care, including young people who have lived in kinship care that have had opportunities to lend their voices in program development and policy reform. So a shout out to Mockingbird Society and Treehouse. Most states have agencies like those. If you haven't tapped into them, that's your next homework assignment, is please make sure that's on your to-do list.
Awesome. Thank you. Anyone else would like to kind of add around the idea of recruitment and kind of, yeah, tips or anything? Yeah, Ambrosia.
So I think to effectively recruit individuals with lived experience, organizations must create really inclusive and welcoming environments that value that diversity and actively seek out contributions from underrepresented groups. This involves building relationships, because relationships are key in the connection with lived experts. Providing mentorship and support. So something I love about this space today, we're going to debrief afterwards. I feel like as a lived expert, I need debriefs built in or at least offered. And then recruiting individuals with lived experience is not only the right thing to do from a social justice standpoint, but it also leads to better understanding of the challenges that the organization is always working to address or more effectively problem solve, and it improves outcomes. We must prioritize the recruitment of lived experience if we want to truly create inclusive, effective, and transformative workplaces. And I also want to say a little shout out to even lived experts with disabilities. There's so many lived experts, right? But including folks' voice at the table.
Awesome, thank you. Yeah, I think that relationship piece is so huge, especially when you're mixing, more professionals with, folks that are typically more lived experience. There can be either a perceived or real power imbalance, where maybe the professionals are speaking more, sharing their thoughts, whatever, and folks with lived experience don't feel like they can kind of get in to say things. And so I really, when I was doing the recruitment for our council, part of it was making sure that the numbers were pretty even so that it wasn't imbalanced in that way. And also, this started in the heart of COVID. All of our advisory councils are on Zoom. And so that makes it a little bit harder to kind of do that rapport building and trust building. But I tried to leave space at every council meeting, especially in the beginning, to do, the icebreaker questions and kind of check-ins and let folks talk about their families and just learn about the whole person and not just that lens that they're bringing to that meeting, which I think was really helpful in our group. And I saw that throughout, I think folks truly felt comfortable to share, even when they were being really vulnerable, knowing everyone was there to support them. And I think doing some of that relationship building stuff in the beginning was really, I think, key for us to get where we are today with our council, for sure. So thank you for highlighting that. Yeah, anyone else?
I'll go. I guess I was going to say also, with recruitment and bringing people to the council, just having different ways in which people can use their expertise. And so, because maybe not everyone wants to speak about it, and that is fine. And so then being able to, also provide like written feedback and have that be an open way of communication, an open form in that direction. Because at times also in sharing that lived experience, it can also bring up trauma that people may still be working through, which I think is noted in the piece of also being able to have that collaborative space after and having the discussions that we have. So just being able to make it accessible in many different forms. Just because, as we know, like some people have great ideas, but they don't want to say it necessarily. They want to wait and they want to write it, or they want to review something and then be able to provide that feedback in that way. So just also making it really accessible for people. And in the recruiting both from in-house of, people who Amara works with directly, and also as Dr. Day said, reaching out to the community and, finding ways to also get the message out, and then just making it, accessible in different ways, because, maybe not everyone right away knows of Amara, but then someone else, knows someone who they can refer. And so just making it very accessible in the, the group and the community that you're reaching out to and trying to see if they have an interest in joining the council.
Awesome. Thank you. And it's interesting when, go ahead.
Sorry, yeah, I just had a quick thought, and I really had never thought this before until this conversation, but it's almost like if you're going to go into a recruitment and bringing lived experience to the table, just really making sure that whatever community partners or professionals are also like trained and prepared for that. Like if you have different folks from outside of like the child welfare or your agency, but really, preparing and having a conversation on how to support and understand what it means to have lived experience at the table. And I just also kind of to everyone else's point, I just don't think recruitment starts there. I do believe that there's this whole thing after recruitment that needs just as much of effort and support poured into it as the recruitment process, because it does bring up, it is vulnerable. You can share your story one day and be totally fine or give perspective, but then 3 weeks from now, it might be different. It might hit differently. And so, somebody could be doing really well and sharing their stories and stuff for like 6 months, but then all of a sudden something else might have brought up some stuff. And so just that it remains consistent, like not just in the first 3 months that they're showing up, but that there's a consistent check-in, that just as much work goes into after recruitment, that goes into the recruitment.
Awesome. Thank you. But yeah, before we kind of move on, I just want to see, Deborah, if you wanted to add kind of how you did your recruitment for your councils.
Yeah. Well, kind of like you, and with Dr. Day, we knew that there was already an existing amazing network of parent allies and parent leaders in our state, and just kind of tapping into who are those people in those local areas where we're going to be implementing and piloting this program, because I wanted people who were on the grounds in those local communities, because that's where they were going to be most effective in being able to get, what are the unique differences in those communities and what are the different challenges. Not all counties in the state of Washington are alike, and there are different areas of, rural to metropolitan areas and different economic and other social factors that are stressing those economies and those communities. And so just kind of understanding what is really going on in those areas, what are the resources and services available, and what is hard or not hard, what are the barriers for things that, families are able to access or not access. And not knowing that, having mostly lived in Pierce and in the King County areas, I knew that we needed to make sure that we had the experts locally of where we were going to do this program. And just through that network of finding people and recruiting and getting people involved in our listening sessions and just hearing about all of these things, like there were a lot of really salient examples of barriers and challenges that families were facing, but also a lot of common themes throughout all of these different counties of the different barriers, or even how to build trust. And I think that is a really huge thing, is how do we build trust with participants and people who would be most impacted by our programs, so that not only are we building that rapport, but we're following through and following up on what it is that we're going to be doing and how we're going to do it. And then if we need to correct our course and pivot and change and be flexible on how that looks, because not everything's going to work out perfectly, and there's no such thing. It's a practice. We're working towards how to continuously evolve and do better. And I think those were the kind of perspectives that we wanted to have. And we met some really amazing people like Ambrosia and Teresa and other leaders in their communities. And the more that we kind of got to know people, the more that we were able to then get involved in other work that they're doing and that they're a part of. And so that we can participate and also know more about what is happening in those communities, not just in our program, but in other parent-led programs that they are working on too. So it's been a really great collaborative and mutually beneficial partnership.
Awesome. Thank you. Yeah. And I think we briefly talked about it as well, but it's wanted to, so we talked about recruitment and now kind of pivoting into like, how do you sustain the work? And so I'd love folks to talk about kind of what are some key takeaways folks should address when kind of doing this work on a continual basis. I know one big thing for us at Amara, and I know Washington State is also supporting this because I think they passed a law around providing financial payment for folks with lived experience, right? Us professionals are showing up as part of our 9 to 5, so we are getting paid to be there. So folks who are coming from the lived experience also deserve for their expertise to be rewarded as well. And so that was definitely built into our budget from day one, was being able to provide a stipend to offset folks' times coming to the meeting and sharing, like folks said, oftentimes some pretty vulnerable and personal life examples, et cetera, to the group. And so we definitely making sure we are providing financial incentive to folks and honoring their time and their expertise. But yeah, I'm curious what other takeaways folks would want to share.
Well,
yeah,
I can share, Trey. I have two top takeaways that I like to share. And I think after working with Kim Plus Advisory Council and looking at the program and how we designed the program and all the reports that we read, my number one takeaway was kids are the number one priority. Although our personal feelings are very important, they were secondary to the kids. And another one takeaway that I got from working with the council, and this is for me personally, is empathy. Understanding that the professionals that I worked with, and especially my social worker, has a caseload of cases and not just my case. So whenever I was asked for information, I tried to get that information back to them as soon as possible. Because there's a lot of work that's going on behind the scenes that I'm not even aware of. So for me personally, I gained a lot of empathy for all the work that's being done for our families.
Mm-hmm.
I love that. That's great. Yeah, Dr. Day.
And if I could add some really important things to consider if you are interested in building a community-centered program design or to do this type of work, that community collaboration takes time and you have to be willing to invest the time. So we've spent about 18 months developing and co-creating the Kin Plus model with Amara and all of the community partners and lived experience experts. So know that to do this well, you have to be willing to invest the time. Groupthink always leads to a better product, but that means building in the time to do the co-creation. So I can't emphasize that enough. Another important point is that, professionals are paid to do their work, and lived expert folks' time and knowledge contributions are equally valuable, and that time should be compensated. And that's an important part if you want to do community center program design well, that you can't tokenize our lived experience experts, and you have to be willing to pay for that knowledge that they're sharing with you. Think of that knowledge as a gift that you're receiving from them. And so what gift are you giving back in return? And so I want you to think about that. And then also, I think an important aspect of the work in building trust in program development is for agencies to really emphasize and prioritize that when they're hiring key personnel and developing the concept and is to turn to lived experience folks to be those key personnel folks. So for example, Trey is a resource parent. He introduced himself as a resource parent. When I introduced myself, I let you all know that I have lived experience in foster care. And, we are overseeing the program design and evaluation activities. I think lived experience folks as professionals can bring that unique sense of credibility and trust to the program. And I want agencies, as they're thinking about and prioritizing their hiring practices, and other university folks on the line, think about who you're admitting into your training programs, and that in order for us to do community design program well, we need to be prioritizing our lived experience folks in our training programs and in our hiring practices in our agencies for in-service work. We absolutely, across this country, need to increase the percentage of folks with lived experience to become professionals in the field. Community-centered program design is a way to give lived experience folks that professional experience that they can use to support them in gaining knowledge and skills to be not only today's professionals, but tomorrow's professionals, and to make those critical connections to the field, as we all know that those that are well networked are the folks that get the jobs, right? These opportunities provide our lived experience folks opportunities to build their networks, which is critical because we know that 80% of jobs are not advertised. So let's just be honest about that.
Yeah. That's great. And, as you were talking, I think one thing I was just thinking about, like, my experience and so, is for the professionals, I think, especially, is you have to kind of check your ego at the door, right? Like, as everyone said, Ms. Pat, Angelique, it's been 18 months of hard work. I'm behind the scenes cranking out process flows and guides and surveys. And then you take it to the advisory council and they're like, I don't like this one. I don't like that one. I don't like that one. And then, like, you take pride in your work. And so you have to be humble enough to get the feedback, but then actually incorporate it, which I feel like is another step, right? I could easily get everyone's feedback, take my notes, and then keep on moving after that meeting and not address any of their concerns or feedback. But being able to, like, sit back, it's not about me. It's all constructive criticism. We're all here in a place of trust, and and being able to take it and be okay and, like, pivot, I think is a big thing. Professionals is to, it's okay to take the criticism and incorporate it and move on, and not take it so personally. So I think that's one thing I know I had to learn a little bit, and some folks on my team who created some trainings and then presented it to the group. But yeah, anyone else? I will get back to the question about recruitment of youth after this, but I just want to see if anyone else has anything to talk about on this topic first.
I think, like, to your point, Trey, like, being able to receive feedback and stuff like that. But I think as someone with lived experience, when coming in and knowing that the thoughts and ideas we have today is the experience of someone else's tomorrow. And are we showing up because we want something done? Or are we, showing up because what we're doing makes a difference for somebody else? And it's not really about us anyway. And it's that humility you're talking about. And I do think that, work being led and that really makes that difference in this work. I really appreciate you saying that.
Yeah. Anyone else? I went to an Indian child welfare training years ago, and they're talking kind of about, like, Western thought versus, like, more indigenous thought. And it always stuck with me that in Western thought, we're all about our family, our nuclear family, and how it's going to impact, like, us. Where in, like, a lot of indigenous cultures, when they make a decision, is how is this going to impact the next 6 generations? And I just think about, like, I've taken that with me. That was like 6-7 years ago, but I think about that in my personal life and my professional life and this work in particular. And I love that. Just, like, it's how this is going to impact the next cohort of folks. I think that's really important, right? So I love that you highlighted that. Thank you. Ambrosia.
Well, and to Teresa's point, I feel like lived experts mentor each other and reach and grab others into the fold, and that's building also generational lived experts into the next level of leadership. It's a whole thing. It spreads. We support each other, and yeah.
Awesome. Cool. Well, yeah, let's go ahead and address the kind of how do you recruit kind of former youth to be on these type of councils. I can talk about what we did. So we don't have any, like, current youth. They're all adults now. And we are lucky to have, like Dr. Day said, some organizations that really worked with former youth in care, so that we have kind of places to go, like Mockingbird and some other places. So for us in Washington State, there's places to go and kind of seek people out. We also put out an ask just on our social media with flyers and just kind of sent that far and wide, and kind of were able to get it. And I think it goes back for us, we got really lucky that a lot of our former youth also have different hats. You know, they're now a board member for Amara, or they're now a kinship caregiver themselves. So like they are able to kind of wear both hats. So we were, I think, a little lucky in our recruitment that we were able to kind of get youth voice along with kind of other folks' lived experience. But yeah, curious what other folks think about how to recruit former youth.
Yeah, I know one place that I encourage folks throughout the country is there's an explosion of targeted campus-based support programs that serve young people formerly in foster care who are now college enrolled. And so I always encourage folks to tap into those campus support programs. Those are students that are getting training right now that are trying to get experience in the field. And many former fosters, myself included, tend to be overrepresented in majors like psychology and sociology and social work. So joining boards like this is giving them resume boosters. And so as you're recruiting them, you're not only paying them, but helping them understand how participating in leadership opportunities will pave the way for their careers in the future. And if you're, you know, advertising this opportunity in that way, that can be really helpful.
Awesome. Thank you. Anyone else had?
I would say, you know, providing collaborative spaces for youth to come together and share their experience, and then using that kind of as a starting point for then also, you know, entertaining the question of like, you know, what are recommendations that the youth have from the experiences that they've had? You know, what are things that they would maybe suggest as far as like changes or things that they feel would, you know, help improve it for the next child that also is going through an experience that they had shared. You know, just providing more spaces that are just that are spaces that they can convene, knowing that to some extent everyone in that room has a little bit of the same experience, but just opening more avenues of that. You know, whether it's providing it to the Department of Youth and Family Services, you know, having flyers there that, you know, allow it to be like over Zoom, or also in-person gatherings that are, you know, throughout the communities. You know, some in the Seattle area, some in the Pierce County area, some further up north, just different spaces where you can hold this space to have a collaborative conversation come together for youth as a way to recruit.
Thank you. Cool. We'll kind of pivot to kind of highlights of how we've seen this work and kind of give real life examples. And I think a really good one from our Kin Plus Advisory Council, came from someone who was a former youth and kinship care, so that kind of segues perfectly into this. But for our Kin Plus program, we do a pretty comprehensive needs assessment at the intake, which is kind of the first meeting with our kinship caregivers. And basically a needs assessment is us asking a whole bunch of questions about, is this something that you and your family need? You know, how are finances? How are medical supports? How are mental health supports? How are you doing as a caregiver? What supports do you need? Just a litany of questions. And so we were going over those questions and going over them. And the one folk on the council who was a youth in care previously said, you know, I was a teenager when I was in kinship care and no one asked me these questions, but I probably could answer about half these questions myself. Like, you know, my grandma didn't need to answer always what I needed. I was a teenager. I could tell the social worker myself. And we were like, light bulb moment. So we created a youth needs assessment that's not as, you know, in depth and intense as the caregiver one. And we're going to use that with all of our youth who are about 10 or over, which, you know, obviously developmental stages, we'll have to kind of figure that out. But about 10 or over, we're going to meet with the youth. And so like, we'll meet with their caregiver, do the needs assessment intake, and then kind of have that time with the youth and kind of go over, see what their needs are. And also I think that helps will build trust and rapport between the Amara social worker and the youth and the home. So to me, I think that is just the most valuable example I can give of why we have lived experience folks, because I don't think any professional, I'll speak for myself at least, that wasn't even on my radar, never would have been on my radar to create a youth needs assessment unless that person had spoken up. So I think that's a huge highlight. I have others, but I want to pass it on to see if other folks have highlights around why this is so important and kind of, any tangible kind of examples of that.
I think another one I would love to highlight, having the privilege of being in the room and watching the conversations unfold, was the Amara staff presenting their shared parenting curricular modules. And our kinship caregivers and our birth parents literally tore it up in a good way, that they were not afraid to say what they thought was good and what they thought was trash. And the curriculum was pretty transformed based on those conversations. And it is so much better than what it would have been if the professionals just did it on their own and were only putting their lens on that. And I can tell you as an evaluator how much I appreciated those conversations. And obviously the end product of the curriculum drastically changed the way that we wrote our evaluation tools to go along with it.
Yeah, absolutely. That's a great example. Yeah, anyone else? Anything from your, yeah, go ahead, Deborah.
Sure. Well, through the design and kind of planning phases of Parent Focus, we had a variety of different people on our advisory groups and listening sessions, mix of parents to DCYF, Division of Children and Family Services professionals and service providers on our kind of advisory group, and just really kind of looking at so many different dimensions of like, what is this program going to do? How are we going to strategize in engaging parents? What are going to be some of the more effective ways of like building that rapport and that trust? And then how do we also differentiate ourselves separately from being the child welfare agency? Because there is a lot of mistrust that parents have, and with, you know, whether you're a caregiver or with a parent, in like being systems involved, you know, are you another entity that is going to be policing my family and myself? And so we really had to strategize together on like, okay, well, how would a parent perceive us in this way? And how do we distinguish ourselves from, you know, being this parent support, and that it's a voluntary program, that they're not mandated to do this, and that they have voice and choice. And those were some really big thematic things that came out of a lot of our listening sessions was, you know, how can we incorporate voice and choice as much as possible when a lot of control has been taken from a lot of these families and their situation, and they're already experiencing loss of control in many other ways too in their lives. And so just how can we be a force for supporting and empowering and really reflecting on and being trauma informed in the ways that we need to be. So that was just some really amazing collaborative pieces that we had early on in the development stages, and that, you know, we are continuously you know, looking at how and examining how is that going with with new referrals that we receive from the state. And, you know, when we're engaging with families, and all their situations are going to be different, and different circumstances that they're going to be in, different contexts that they're going to be in emotionally, and whether they're going to be welcoming or feel welcomed by us. So there are all these different things that we continuously evaluate and supervise around.
Awesome. Anyone else? I know we're getting close to time, and we do have one more question here as well. So I'll read the question, but folks can either answer kind of the highlights or answer this question. So what data or findings led to the deeper understanding of the deep importance of kinship caregivers? Yeah, I'm trying to decipher that question. Is it asking just like, why are we putting bigger emphasis on kinship caregivers in general, or within this context? But yeah, go ahead, Dr. Day.
I know I'd love to see folks, the person who asked this question, ask follow-up questions. So I will answer this the way I think you've asked it, but please re-ask your question if we're not doing a good job answering it. So in terms of pre-work that was done from a research standpoint, unfortunately, we don't have good data in the literature on the utilization of kinship voice in program development. It is not there. I think we are generating that literature through this project. We certainly have literature for former fosters in program design. So we have that to relate to. The information on birth parent voice is virtually non-existent. Like I said, this project is really creating those findings, which makes Kin Plus such an exciting project. It really is breakthrough in terms of generating new knowledge from the point of research and use of research in an academic environment, and utilizing that type of research for policy and practice reform. I will say that, and I'll be honest with everybody on this call, that there is a divide in the research community in terms of the value of lived experience in program design and evaluation. I know I've been personally criticized by other researchers about whether or not having lived experience biases my ability to do evaluation. I feel, frankly, that, you know, anybody can touch a button on SPSS to look at effects, whether or not you have lived experience. But I will argue that that lived experience gives you a unique lens to interpret data that if you don't have lived experience, you just don't have. And so I'm going to allow that debate to continue in the research world. Obviously, I do have strong feelings that lived experience people are important and critical to research and analyses, and hope that we see that trend increase over time in the field from a research perspective. And I want to encourage all the agencies listening in to embrace that concept. And hopefully this project and the findings that we document throughout will be great justification for that.
Thank you. Yeah, and just in case your question was more about, you know, why are we putting more emphasis on kinship care placements? The short answer is there's been a lot of research out there that shows the kids' outcomes when compared to being placed in a more traditional foster parent type situation, better outcomes educationally, behaviorally. And I think the big one is that kind of cultural piece of being able to stay in community with known people who you know, have relationships with already. I think from a racial equity standpoint, it keeps kids connected to their culture and their race and all that for racial identity. And so that's kind of why the field is moving that way. It's just, it's a better outcome for kids. It keeps them closer to their loved ones and family and friends. And so that's kind of the very short answer, because I know we're short on time in case that's what that question was alluding to. But yeah, I guess if anyone has any final last words on the panel.
I have one, Trey, that I was going to add. I guess also I think the deeper dive that we were able to take with, you know, the council that we came together with the lived experience was also just, you know, really calling out and bringing to light some of how the system has previously run, and just saying that, you know, there are still, I feel like, many communities that are weary of working like with the system as it is, you know, and just kind of calling how we can make some of those changes so that then it can feel like a more accessible and inclusive space to be in. And so I feel like, you know, with our group, we were also able to have that collaborative space and a space that was able to be respectful. You know, people, I think, at least for myself, I can say I definitely felt supported in speaking out about things that we were looking at. And I hope others felt the same. But that, yeah, it was really a good space to be able to say, you know, as a Black individual, you know, I think that there is that systemic hesitancy of wanting to get involved and wanting to do so many things. But I feel like we also are able to acknowledge that and look at workarounds and ways to make it more accessible for everyone.
Awesome. Love that final comment statement. Thank you so much. All right, I am going to pass it back to Ruth for our wrap up.
All right, thank you. So first thing is I just want to take a moment to say thank you to all of you for this time today, the wisdom, inspiration that you're bringing to people across the country and to us at Amara every single day. So Trey, thank you for facilitating. It's always wonderful to have you leading. And to our incredible panelists, Patricia, Deshauna, Teresa, Ambrosia, Dr. Day, and Deborah. I'm sure you have left people feeling inspired and thinking, okay, how can we do this wherever we are or bring this to our organization? So thank you. To all of our attendees, thank you for coming and engaging in this conversation. I know it can sometimes, newer things can feel, people can sometimes feel like, I don't know about this. And I hope you're feeling like, okay, yeah, no, I'm a little more convinced today, if you weren't before you started this call, as to why centering lived experience is just so important, especially as we're developing new important projects. We'll send this recording afterwards. And if you have any other follow-up questions that maybe didn't get answered today, just reply back to that email from the recording and we'll either work with the panelists to get an answer for you, or if we can answer it ourselves, we will. We also have a few resources that we'll send some links to as well. So kind of closing us out, just as you heard today, foster care is so complex and it can have ripple impacts for generations to come. And so pushing ourselves to evolve and learn and change and grow, it's just so, so important. And this is part of that work at Amara. So thank you for being in this conversation about that. And then lastly, I wouldn't be doing my job if I also wasn't saying and sharing that we're a nonprofit. This is a work of community, and it's made possible because we have a lot of people who really care and want to make a difference and come together. So this is not for government to solve on its own. It's not for individual family units to solve on their own. There are too many systems in place that make it that's just not possible. And so that's where Amara is just so grateful that we're trusted to be a partner in all of this. And that we have people who maybe their day job is doing something completely different, but their way of partnering is supporting and showing up and being part of the conversation. So I just want to encourage you, whether you're local and Amara can be your place or wherever you are, find that organization that is doing something different and really pushing for changes to the system. If you are local, we would always love to see you at future events. We have an event in person coming up on May 11th. If you're in the Pacific Northwest, we'd love to have you, or come to a future Speaking of Change. If you have a little extra and you can make a gift online, that always goes a long way in helping make all of this work possible. So thank you, and know that there are organizations like Amara all over our country trying to do this work and find a difference in the community. So all right, that's my plug. Again, thank you, everybody. Have a wonderful afternoon or evening if you're on the East Coast, and thank you for being on this journey with us. Take care.
Bye.